We want to get back to that breaking story. The state Senate approving the abortion ban after 12 weeks in most cases. Want to get new insight at this hour. Joining us is an assistant professor of obstetrics and gynecology at Duke Health, Dr. Jonas Swartz. If you can tell me, Dr. Swartz, your immediate reaction to the passage of this bill.
Well, I'm really disappointed. It's a gut punch. This isn't the right choice for North Carolina. This abortion ban will hurt my patients. It will hurt my practice. It will hurt our ability to train medical students and residents. And most importantly, it's just not the right choice for allowing us to provide compassionate and comprehensive care to the people in our state.
Looking forward, how might this affect care in North Carolina? We've seen similar bans in other states. How has that impacted other states? And in terms of the clarity of the language in the bill as well, what impact does that have on doctors being able to do their jobs?
Well, looking way forward, I think that this is just a stepping stone where these legislators intend to ban abortion altogether in North Carolina, which is what we've seen in other states. Right now, what this is going to mean, or if this bill goes into effect, it is just going to make it difficult for people to access the care that they need. And that care between 12 and 20 weeks is essential. The increased administrative burden is frankly insulting because it assumes that we are not doing our best to counsel patients, to provide compassionate care, and to help them make the right decision for their lives. And we are. And it increases the burden, such as requiring 2 in-person visits prior to having an abortion procedure, that may make it untenable for people to access abortion even before that 12-week mark. And we know will do nothing to improve the quality of care.
We did see that every major medical group spoke out against this bill, saying that it just was not going to be clear enough in terms of how medical groups would be able to provide the care for women. Tell me, moving forward, I guess the question is, what should doctors do to help women?
Well, we're going to do everything we can to continue to provide care for our patients, of course, in compliance with this law. But honestly, we're going to have to spend a lot of time with lawyers to figure out what exactly the administrative requirements are. This is a poorly written bill on top of being bad medicine. It has a bunch of provisions that are poorly defined, a bunch of terms that are poorly defined. It doesn't make clear what the legislature considers a medical emergency. It doesn't make clear what the legislature considers a sort of fetal anomaly that would meet criteria for an abortion. Up to 24 weeks is what the bill provides. So legislators, I think, make poor physicians was a pin that many of the legislators were wearing today. And it's absolutely true. This is not giving us the ability to provide the best evidence-based care for our patients.
Dr. Swartz, thanks so much for your time.
Thank you.